So in this week's muscle breakdown, we're doing some live in-person training, and I wanted to cover some nerve entrapments and how to recognize when you're having a nerve entrapment and how important they are, specifically for down through the extremities. So that's what we're going to be covering in this week's video. So everybody, Dr. Matt Maggio, creator here of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new method that allows them to easily double their income, all while working 50% less. So we're in the middle of doing some in-group training, which has been really awesome so far. Leah's been working with us for a while, but what I want to explain today is the idea of what's called peripheral nerve entrapments. I said that right? Peripheral nerve entrapments. So I talk about nerve entrapments all the time. So whenever I'm breaking down problems in the human body, we always talk about the idea of like 7 problems in the human body, and they break down to like bone, disc, cartilage, ligament, nerve, tendon, and tissue. Got all those, right? If you ever want to learn about that, we do have links to our free training and stuff like that. One of the most common problems in the human body is actually called a nerve entrapment. And I've said this before in past videos. There's over 256 different places in the body where you can get a nerve entrapment. And when you get a nerve entrapment, they kind of present with things like numbness, aching, and burning. And a lot of times people miss them and they don't realize that that's actually happening. So I've done over the last couple weeks like covering different types of nerve entrapments down through the arm, but I wanted to really dive into like where to feel it and then kind of demonstrate some areas where we would do some treatment. So come in a little closer. So 3 of the common areas and nerves that we're going to have problems in is going to be the median nerve, the radial nerve, and the ulnar nerves. They're the 3 biggest nerves up there. And what happens a lot of times is these nerves begin up here in the neck, and they come out through what's called the scalene. So you have your anterior scalene, your middle scalene, and your posterior scalene. So if you're watching this on our YouTube channel, I do have some breakdowns where we go in and do some palpation on that. So go back and look at that. So then what happens is these nerves come out, and then they go down underneath the clavicle, and then they go back through and they sit right on top of what's called the subscap. And they form these things called the brachial cords. So in the brachial cords, they break into different branches, and they break into the median, the ulnar, and the radial nerve. So one thing that we teach in our training is asking the right type of questions. You know, where do you feel the pain? Like symptom location is really important. So when we talk to a client and they say, hey, I'm getting numbness and tingling down my arm, what I always ask is I go, where are you getting that? Clients don't really think you want a lot of details, but in the Peak Method, we want details as we're going in there. So I say, where are you feeling that? So I have them really point. So a lot of times as we're coming in, so let's do median nerve first. So a lot of times median nerve ends up being the culprit for what's called carpal tunnel. But that doesn't really tell us anything. Anything I always say that says has syndrome in it is usually bullshit for, I don't know what's really going on. So what a median nerve will present with a lot is some numbness and tingling and a little bit of pain in through here, and then up through here, and a little bit of that 4th finger. So that can be symptom location where you get that. So we're looking at that when we take a history. Where do you feel it? And what type of pain? So they'll say some numbness, tingling, and they'll also say through here. So in my mind, I'm thinking, oh, possibly median nerve. So let's trace the median nerve back up. So then it comes in here, and it actually goes through this tunnel in here, and that's called the carpal tunnel. And where it makes its way up is right here through the medial part of the elbow and the arm. And where it can actually get caught is first really deep in here. There's a muscle called your flexor digitorum superficialis. I practiced that one. Flexor digitorum superficialis, and then the other one where it comes in is the pronator. So the pronator kind of comes from the medial side and goes like that, and where it's jammed up, and I can already feel she has a little bit of tension in there as we go. It gets caught first at flexor digitorum superficialis, then it also gets caught on pronator teres. You can see that's a little tender in there. So that's median nerve. Now radial nerve is a little bit different. Radial nerve will present first with some lateral elbow pain. And that's when you get the people that come in and they have tennis elbow. I always get, no, golfer. Lateral is golfer.
I thought it was tennis.
Lateral tennis.
See, that's why we have people here. I don't even know because
you taught us something.
Because they're bullshit diagnoses anyway. So tennis elbow is going to be the lateral one. And what happens is the radial nerve comes down through here. So a lot of times people will present with some pain in the tricep back through here, and they'll have lateral elbow pain. And where it can get caught is right in here in some of these extensor muscles. So it gets caught down through a lot of the extensor digitorum It gets caught in extensor carpi radialis. You can even get a little bit on the deeper part, and where it really gets caught is down deep into that supinator. And you can see when we feel in that area, it's really tight. And a lot of times the client will actually say that they get some numbness and tingling in the web of the hand. So radial nerve will present with some numbness and tingling down through there as well. And then our last nerve is going to be the ulnar nerve. And so this will cause golfer's elbow. I got it right this time. And what a lot of people with,
Will you face this way?
there we go, as we get in here with this one, the first place it'll get caught is it comes right here through the lateral part of the elbow in the flexor carpi ulnaris. And then it goes here. And then where it starts to get caught again is right down in here in another tunnel. And it's a fancy tunnel called the tunnel of Guion or whatever you say. And a lot of times the client will present with some tingling and numbness on the lateral part of the finger in through here and in through there. So what happens is it gets jammed up in different areas throughout there. So that's where to find those areas and see where the problem is causing. In next week's video, I'm actually going to do a breakdown showing me doing some treatment on each of the common nerve entrapments in here so you can get a better idea. So make sure you tune in next week.